Hope I hope I'm loud and clear.
You're
Adrian,
perfectly audible.
thank you. Uh, as you have heard, I'm Dominic, and I'm glad to be here. Allow me not to use my video. Allow me to do my audio only for purposes of where I am. And today we are going to talk about two common health conditions, one being the Parkinson disease, and then later you're going to look at stroke. So we will utilize the time that we have for the two. I want to start by saying that the Parkinson disease is, as Fred has correctly put it, is a disease that affects our nervous system. The way we respond when we are touched, we respond. When the voices come to us, we get to hear and distinguish between voices. That is the nervous system that enabled us to receive stimuli, receive messages, and be able to interpret those messages accordingly. That is the nervous system. So Parkinson disease basically is a disease of the nervous system. And we want to start from somewhere. We want to ask. I want to ask ourselves, what is Parkinson disease? Parkinson disease primarily affect movement. We are saying it is a nervous system disease, a disease that affects the nervous system, and it affects movement. We are saying that it's like the movement software, the part of the brain, and we can see on our diagram, we are calling it the substantia nigra. This is the part of the brain that controls movement. So it is a movement software that get blocked, yes, maybe blocked is a better way, that get challenged in its own way of working. So it gets charged, that movement software, when the nervous system is affected. It occurs when specialized nerve cell in the part of the brain we are referring to as the substantia nigra, those cells, they die or they become damaged. When those cells become damaged, then in that case, we are saying that Parkinson's disease is going to be developed. It's good to say that this substantia nigra, they produce dopamine. And dopamine is a hormone. You can call it a chemical messenger that coordinates a smooth and controlled movement. I mean, you can be able to move in a manner that is controlled, in a manner that is smooth, without, you see, I want you to compare this with somebody who is drunk. A drunk person will never move in a straight line. And from afar, you can tell that this person is not okay. Maybe somebody is feeling dizzy. You may tell that this person is not okay because their movement are not coordinated. So we are saying the substantia nigra secretes a hormone called dopamine, and this is a hormone that it's a feel-good hormone. But in addition to being a feel-good hormone, we are saying dopamine coordinates smooth and controlled movement. And as dopamine levels drops, why is it dropping? It is dropping because this part of the brain, the substantia nigra, the cells making that part of the brain have been destroyed. That's what we've said, have been damaged. And for that reason, the secretion of dopamine drops, or the secretion of dopamine nosedives. Therefore, the person realizes symptoms like tremors. Tremors is shaking, or even stiffness of especially around especially around the joints. You get stiff, and even the motion becomes slowed, and even balance problems come to emerge. All these are things that will happen in case this part of the brain is destroyed, and therefore the concentration of dopamine that is being secreted by these cells goes below the required amount. We want to look at the symptoms of the Parkinson disease. I have already alluded to some. I've talked about tremors, slowed motion, but then we want to categorize them into two. There are those symptoms that are motor symptoms. Motor symptoms means they affect your motor part of the body. The motor part of the body is the part of the body that that moves the part of the body, especially the arms and also the legs. Those are the parts of the body, and even the neck and the head. They are movement all over the part of the body. Those parts of the body that moves, then we can say they will receive now symptoms around that. We've talked about the tremors, the shaking. You can call it the shaking. We can. We have another one, which is tremor. We have slowed movement. Slowed movement and reduction of movement that makes simple tasks like buttoning a shirt or walking laborious. Yani, your movement becomes so slow such that the movements around the parts of the body that moves, such that even something like buttoning a shirt becomes a very heavy task for somebody to be able to carry it out. We have rigidity. Rigidity simply means stiffness or inflexibility of the ribs and trunk that can cause aching and limit the range of motion. So basically, rigidity, when you say that a part of the body is rigid, it means it is inflexible. It is not easily flexing. It is still stiff, and especially the ribs, and also the other part of the body, the trunk. That is also a sign that Parkinson disease is maybe the cause of all these symptoms. And later we have postural instability. Postural instability simply means impaired balance and coordination that increases the risk of fall. You can't balance. You can't walk on a straight line. You are walking like somebody who is drunk. Somebody who is drunk, yet you've not. Yet this patient hasn't taken any form of alcohol, and then this one mostly happens in later stages. Those are the motor symptoms. But we have non-motor symptoms. These ones are not involving the part of the body that are moving, and we call them the non-motor symptoms, which can precede the motor issues. These ones, non-motor ones, the ones that will occur in parts of the body that are not moving, but they can come before even the motor ones appear. Like, for example, loss of smell, or even sleep disorders, or even autonomic dysfunction. Autonomic dysfunction are things to do with something like constipation, low blood pressure, urinary issues. Those are autonomic dysfunction. When such happens, then it's an indicator that Parkinson disease could be the cause of all this. And we are saying these non-motor symptoms, they could appear, they could precede now the motor symptoms. They could come before even the motor symptoms now comes into play. We are talking about neuropsychiatric changes, such as depression, such as anxiety, such as apathy. Those are the neuropsychiatric changes. We have cognitive changes that can range from mild slowing even to dementia, that can range from mild slowing all the way to dementia. So these are the symptoms of the Parkinson disease. Na tunasema these non-motor symptoms could precede now the motor symptoms. So we want to answer this question: what is this that causes the Parkinson disease? We have already answered this question. Maybe we can look into it further, maybe in a wider way. But we have already talked about the dopamine, this hormone that is produced by this part of the brain. The part of the brain that whose cells are destroyed and now leading to this. We are saying that dopamine is a feel happy hormone. We have already mentioned that, but we have also said that it coordinates movement. So we are saying, if at all you have deficiency in dopamine, and why will somebody have deficiency in dopamine? We have already answered that. We are saying that the dopamine producing cells, if they gradually die, if they gradually die or they get destroyed, then at that time, then we are saying the Parkinson disease is going to happen. By the time symptoms appear, about 60 to 80% of these cells are already destroyed. So by the time these symptoms that we have just discussed appear, the 60 to 80% of these cells, the dopamine secreting cells in that part of the brain that produces dopamine, will have been destroyed. The second cause is what we refer to as the cellular culprit, or what we refer to as protein crumbs. Now, inside the brain cells, scientists have found abnormal crumbs of a protein of protein. And these cells are cellular trash that neurons can't dispose properly. I want to explain further. We are saying in the cells themselves, the brain cells themselves, we have abnormal crumbs, which are proteinous in nature. And those abnormal crumbs, they can be said to be cellular trash. It's like that within the cells, within the cells, it's like that in the cells. And the neurons or the nerve cells that makes up the brain cannot be able to dispose them properly. So these crumbs, crumbs, and may become toxic to the brain, and therefore disrupt the normal brain function. Going back now to dopamine, and among the many things that the brain is supposed to do is to secrete this good, happy, feel good hormone, also a hormone that coordinates movement, the dopamine. So we are saying it is basically the crumbs. It is basically the crumbs, and we are saying the cellular culprit could be another cause. Genetics is another. What this one means is that for most people, Parkinson results from a complex complexity between genetics and even the environment. For the genetics, maybe genetics and environment, they are related. They are not one and the same thing, but they are related. For the genetics, it talks about the family history. Do you have someone in your family who has had Parkinson disease in the past? The likelihood for you contracting the same is much higher as compared to somebody who has no history of the Parkinson disease. We are seeing about 15% of people have a family history. Those people, 15% of people who have Parkinson disease have 15%. 15% of them have a history in their family, and maybe this is caused by gene mutations. Mutation basically means a sudden change in the genetic constitution of an organism. So there is gene mutation, mutation, that sudden change happening at the gene level, we call it gene mutation, can increase that risk. But then there is also the environment. Exposure to certain pesticides, herbicides, or industrial chemicals appear to increase the risk. Also, head injuries may also play a role when it comes now to the causing of Parkinson disease. There are other factors like age, whereby risk increases significantly after the age of 60, And when it comes even to gender, the men are 1.5 times more likely to develop Parkinson disease more than now the women, more than the women. Let's talk about what usually happens. Parkinson disease happens through a gradual and complex neurological process that begins. If you look at my diagram here, this is a diagram of a neuron. This is a diagram of this is a diagram of a neuron. And we are saying it is a complex neurological process that begins here before even the symptoms even appear. We are saying even the non-motor symptoms, which we are saying are preceding the motor ones, even before level. When I talk about the neurons means nerve cells. And we are not talking about any nerve cell, but we are saying it is specific nerve cells deep in the brain region. In this region, we are calling as the substantia nigra pars compacta. That plays part of the brain we have just mentioned that secrete dopamine. We are calling the substantia nigra pars compacta. This is the part of the brain that secrete dopamine. And if the cells, the neurons, the nerve cells of that part of the brain are destroyed, then this is exactly where all these start from. We are saying these cells, when they are lost, these cells are very vital when it comes to secretion of dopamine. And dopamine, we have already mentioned that it is responsible for smooth and coordinated movement. When all these cells are lost, dopamine levels also, the dopamine levels also, they also get, they also plummet. In that area we are referring to as the stratum, plummeting means they fall suddenly and steeply. So meaning when these cells are destroyed, it means secretion of dopamine levels also decreases, and therefore for that reason now the levels of dopamine goes down suddenly and very steeply, and then that disrupts the brain intricate motor circuit. That part of the brain that coordinates now this movement, coordinated and smooth movement, is usually affected. We are saying there is also a biological trigger for this cell death, and it's linked to abnormal accumulation of protein. We are referring to the alpha synuclein, which comes together. Remember, we have just mentioned that there is a protein cramps, the cellular culprit, which is a major cause for this disease. So we are saying this one can also, that abnormal accumulation of that protein clots or the protein cramps, then that can also trigger now. Remember, it's affecting these cells in the substantia nigra, and if they affect these cells, they come together inside the neuron, forming what we're referring to as the Lewy bodies. So when they come together, they become toxic, disrupting cellular machinery, impairing energy production, ultimately leading to neural dysfunction and even death. And the moment those cells die, the cells of the substantia nigra, then the secretion of the secretion of dopamine decreases, and in so doing, definitely we know that now the movement will be hampered. Now, let's talk about how the Parkinson disease now progresses. After now, those cells are destroyed. So in the early stages, symptoms are often subtle and unilateral. What that one means is that there is subtle. Subtle can mean very little. It's not much. There is some symptoms at the early stages, like now a tremor in one hand, that shaking in one hand. It can be reduced arm swing. You want to swing your hard, but it's reduced, or even smaller handwriting. You realize that somebody who had we are saying somebody who had a good handwriting, all of a sudden realize that the handwriting has reduced in size. All these could be mistaken for maybe for normal aging. We are saying it affects people mostly who are over 60 years, but maybe it's the Parkinson disease. This phrase is marked by brain a remarkable ability to compensate for the gradual loss of dopamine producing neurons. Then, as neurodegeneration continues, then we enter the moderate stage. We enter the moderate stage. Now, when we say that we enter the moderate stage now, we are saying now the symptoms become more pronounced, like tremors and rigidity affect both sides of the body. Remember, in the early stage, the tremor was only in one hand, but now this time around, it affects both sides of the body. Then there is the slowness of movement. That one worsens. Maybe they were moving at a particular speed, maybe 20 meters per minute, but now this time around they are doing 5 meters in a whole minute. Slowness of movement even worsens, and even balance begin to falter, and off periods emerge, whereby now it's like they go off and they fall down, and even non-motor symptoms like loss of smell. You remember we talked about this, sleep disturbances, constipation, mood changes, all these. It's at the now the moderate stage. Now, when it comes to the advanced stage, when it comes to the advanced stage of this disease, now motor complications become severe and complex. Like now, one of the symptoms we talked about is postural instability. Tulisema postural instability means difficult maintaining balance and stable posture, from the word posture and instability. Postural instability, you are difficult maintaining balance and stable posture. Then it increases significantly, and there is the tendency for somebody to you have a risk of falling down at any one time. Then we have a freezing of gait. That means sudden brief inability to step. You all of a sudden you can't make a step. You frozen at one position. That is an advanced stage of the Parkinson disease. And then we have involuntary twisting movements may appear as the side effect of long time use of levodopa therapy. I'll talk about that later. And then non-motor issues such as cognitive decline, hallucinations. Now we are in the advanced stage. Severe autonomic dysfunction, like blood pressure drops. You know, ordinarily blood pressure rises, but when you realize that this blood pressure is dropping beyond normal, then we are saying it's a form of severe autonomic dysfunction. And even speech and swallowing difficulties, speech and swallowing difficulties, all these are possible symptoms when it comes to now advanced stage of this disease. So basically, how is this disease treated? How is this disease treated? So I'll move a bit faster. How is this disease treated? While there is no cure for Parkinson's disease, treatment can significantly improve the quality of life. And one way in which Parkinson's disease is usually managed, we are saying treatment, there is no cure known for this disease, but we are saying managing it is going to make the condition now to somebody to live with this condition easily. We are saying we start with the medication. The gold standard is levodopa. Now, levodopa is a dopamine replacement. It is the primary treatment for Parkinson's disease. It is a precursor of dopamine. Yani, it is a what? It is a form of artificial dopamine, maybe for lack of a better word. It's an artificial form of dopamine. So this levodopa is the one that is used for purposes of treating this condition or managing this condition. We are saying we are managing it. And when converted to dopamine in the brain, that is the levodopa, it will help restore movement control, because we are saying it is an artificial form of dopamine. So when it is get into the brain, then it will restore movement control. Other medications can enhance dopamine effect and target different. But then we have brain pacemakers. For some patients, surgeons implant tiny electrodes in specific brain areas. And these brain pacemakers deliver electrical pulses that block the abnormal signals causing symptoms. So this one is surgery that is done, and then a tiny implant of an electrode is placed in the brain, and this one will deliver pulses, electrical pulses, and then it blocks those signals that causes the disease. Then we have the physical therapy, whereby this physical therapy is for purposes of improving mobility, balance, and strength. But then there is speech therapy, because this one addresses soft speech and swallowing issues. And even exercise is going to really help even managing this disease. Now we are saying, how can we shield our brains from now this disease? We are saying there's no guarantee prevention. There's no guarantee prevention, but suggestions and strategies has been put across that may reduce the risk of somebody contracting the Parkinson's disease. And we are saying move regularly. People who engage in regular aerobic exercise have a significant lower Parkinson risk. Aim for about 150 minutes weekly. 150, you can divide that one by 7 and get to see how many minutes per day. And then take coffee and tea. Caffeine in the coffee and tea show reduced risk in numerous studies. Numerous studies have shown that. But also, we are talking about the Mediterranean diet. This is a diet that is rich in fruits, that is rich in vegetables, that is rich in whole grains and healthy fats. All those ones are going to really come in handy to help and reduce the risk of contracting this disease. Avoid toxins, limit your exposure to pesticides and herbicides where possible. And then we are talking about head protection, because we said this can also cause now this disease. Use helmets during activities with fall or head injury risk. And then stay socially and mentally active. Engage the brain so that it may become more resilient. We want to look at Greenwald's solution to this disease. or rather greenwood products can help now when it comes to management of this disease. The first one being the spirulina plus capsule. We are saying spirulina capsule is rich in vitamins, especially vitamin C, vitamin E, and flavonoids. And these ones protect the brain cells from oxidative stress, which contributes to neurodegeneration. So those vitamin C, vitamin E, really, and flavonoids, they protect the brain cell from that oxidative stress. Then we have magnesium, which may reduce muscle cramps and promote relaxation. It's part of the ingredient in spirulina. Then we have vitamin D, which support bone health. And when it supports bone health, there is the reduced risk of falls. But then we have fiber that you also find in the spirulina, alleviates constipation, a common Parkinson disease symptom. So we are saying after taking the levodopa, that medication that is used for treating or rather managing a Parkinson disease, it is an essential treatment for Parkinson disease. This levodopa, this is a precaution, by the way, when taking spirulina. Levodopa should be taken at least 2 hours apart from now that spirulina, because spirulina is a high protein food. So you should at least separate it by 2 hours. The other two products which can really help, we have deep sea fish oil. It is rich in omega-3, and this one reduces inflammation. And deep sea is our product for purposes of any inflammation, and also supports brain health and brain function. Then the super CoQ10 is an antioxidant, the same function like the vitamin C and vitamin E and flavonoids in the spirulina. Being an antioxidant, it may improve cellular energy production and reduce now the neurodegeneration brought about by the oxidative stress. Now we have the final product here. We are calling it the ginkgo biloba. This one contains also flavonoids like the spirulina, and we also have some terpenoids, which are potent antioxidants. Those flavonoids and terpenoids, they are antioxidants. And the moment you talk about antioxidants, they scavenge on those highly charged particles we refer to as the radicals. And these compounds, they neutralize free radicals, which cause oxidative stress and damage the brain cells. So oxidative stress is a key factor in the neurodegeneration, the destruction of the neural system seen in Parkinson disease. So when you reduce the oxidative stress, then by taking ginkgo biloba, you slow the progression of the Parkinson disease or even alleviate some symptoms. So ginkgo biloba is also known to improve circulation and also increases blood flow to the brain. And in Parkinson disease, where now the motor symptoms are linked to reduced blood flow to certain brain areas, then we say that improving circulation could potentially support better brain function and even motor coordination. So the other product, maybe the final one, is blueberry super nutrition. This one has 3 ways in which it comes in handy. And it's important to mention that blueberry super nutrition help the Parkinson disease due to their high levels of antioxidants, particularly the anthocyanins. So it's important you note the kind of antioxidants that you find in all these products, from the vitamin C, E in spirulina to flavonoids and terpenoids in ginkgo biloba, all the way now to the anthocyanins, which now are the antioxidants you find in the super nutrition. When it comes to neuroprotection, the antioxidants reduce oxidative stress, which now we have already mentioned, it contributes to the neurodegeneration process. And then we have inflammation reduction. These anthocyanins, chronic inflammation play a role in the progression of Parkinson's disease. And these blueberry and the cyanins, they have anti-inflammatory properties, which reduce brain inflammation, potentially showing the progression of the disease. And even when it comes to cognitive functions, we are saying that blueberry have been shown to improve memory and cognitive function in some studies, and the ability to enhance brain plasticity and communication between brain cells. So for cognitive function, super nutrition is coming in handy. But then we also have the dopamine regulation. While not only directly increasing dopamine levels, the super nutrition, the blueberry in the super nutrition, but they also indirectly support the brain's ability to maintain healthy dopamine systems due to their neuroprotective effects. So basically, those are the products we had spirulina, we had Dipsy, we have Super Q10, Jingo Biloba, and now the blueberry super nutrition. Thank you very much. Allow me to stop this share. I hope you have learned something as we talk about now. We talk about the stroke. As we talk about the stroke. Thank you. Good. Oh my. A minute, please. Yes, there we are. So we are going to talk about stroke. A few minutes that we have so that we can understand. So stroke is another common health condition. It's related to Parkinson's disease. There is some correlation, though the Parkinson is a disease of the nervous system. This one is a disease of the vessels that supply the brain with blood. Now we are saying this is the second. Stroke is the second leading cause of death worldwide. In Kenya, in the year 2020, about 15,895 people died. That is 6% of all the deaths that occurred in the country, in our country, Kenya. And this it is also a leading cause of death among the non-communicable diseases. There are those diseases that can be transmitted from one person to the other. Stroke is not one of them. And we are saying it is a leading death. And therefore, the reason why we should look at it. What is stroke basically? A stroke basically means it is a brain attack. And it occurs when blood flow to the brain is blocked by a clot, or when a blood vessel bursts or it ruptures. Basically, that is what stroke is all about. So blood flow to the brain is blocked. And you know, when blood vessels to the brain, especially those that are carrying oxygen and nutrients to the brain, when the blood vessels are blocked, then the brain become deficient of oxygen, become deficient of nutrients. And when that one happens, then the brain cells will begin to die within minutes. And the effect depends on where in the brain it happens and how much it is damaged. And it may potentially cause a paralysis, even speech loss, or even vision problem, or even death. So it is a medical emergency, we are saying, and it can change life in an instant. So it can happen to anyone at any age, at any time. So it's good that we get to know something to do with it. So we have understood what stroke is all about. It's basically blockage of blood flow, especially blood that is rich in oxygen, a blood that is rich in nutrients to the brain. Now, what causes stroke? We have two categories of causes of stroke. There are those categories that can be said to be treatable causes, causes that you can be able to avoid them and avoid them completely. But there are those that can be said to be non-treatable causes. We are calling them uncontrollable causes, uncontrollable factors. And then we are calling treatable causes, or we are calling them controllable causes or controllable factors. And all strokes have underlying causes, but most strokes are caused by other conditions called risk factors. The common risk factors for strokes are well known and also treatable. These include something like high blood pressure, diabetes, high cholesterol, smoking, obesity. All these factors, they are controllable because we can be able to control all these ones. They are under our control. And we know there are factors that cannot be controlled. Factors like age, factors like race, factors like ethnicity, factors like family history, factors like previous stroke, factors like TIA. TIA is transient ischemic attack. We are going to look at it in the coming slides. And this one happens when the blood flow to the part of the brain is temporarily blocked. Not completely blocked, but temporarily blocked. So out of all these factors, as we can see, there are those that are controllable. We can be able to control them, but there are those that we can't be able to control them. What are the signs and symptoms of stroke? What are the signs and symptoms of stroke? Now, we are going to use an acronym, Be Fast or Act Fast, but it is Be Fast. Why? Because a stroke symptoms in someone, you need to act fast and call emergency medical service immediately. Time loss, if you waste any time, it can lead to more brain loss. So stroke causes a lot of different symptoms, but now we are going to use this acronym Be Fast. The acronym Be Fast. Here is one that is up here. I hope you are spotting it. This one. So we'll be able to now, starting with B. B means B is for balance. What that one means is that ask the person to stand. And does the person have trouble staying on their feet? So if there is loss of balance, headache, dizziness is a sign of stroke. Then E stands for eyes. Ask the person if they can see well, clearly, or they are seeing things double, or they are seeing is blurry. If there is any decrease in vision, something that is not normal with them, then it's a sign that somebody may have contracted stroke. Then there is the face. Does one side of the face droop or is it nap? Ask the person to smile. Is the person's smile uneven? If that be the case, that is stroke. Then when it comes to A, it means arms. Arms weakness. Now, is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downwards on its own? Then it's a sign of stroke. But then there is also the speech therapy, not therapy, but the speech diagnosis, whereby you diagnose using the speech. So S for speech. Does this person have speech difficult? Is the speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a sentence like, whichever statement, the sky is blue or whatever. Does the person is able to is the sentence repeated correctly? Now, if that not be the case, is a sign that stroke. We are saying these signs are so many, but we are summarizing them with this acronym B fast, because a stroke is one type of condition you need to act very fast. And then we have T for time to call emergency a medical service. So stroke is an emergency, even minutes count. Call for help immediately. If possible, look at your watch, phone, clock to track when symptoms start. Telling a healthcare provider when symptoms started or began can help them know which treatment options are best for stroke. We want to look at the types of strokes. There are three of them. Ischemic stroke, we have hemorrhage stroke, and we have the TIA, the transient ischemic attack. Now, talking about the ischemic stroke, we are saying that it usually happens when a blood clots a blood vessel connected to your brain, connected to the brain. Issues that can cause those kinds of clots, we have talked about them. Some of them we have talked about them. But one of them is the atherosclerosis, the hardening of the arteries. If hardening of the arteries happen, and then there is a clot that blocks the blood vessels leading to the brain, then we are going to have ischemic stroke. So basically, we are saying ischemic stroke is basically now blockage of the blood vessel that supplies blood to the brain. And we are saying there are many things that may cause those. We are saying the main one being atherosclerosis, which is hardening of now the arteries. Then we have clotting disorders, such as clotting disorders. There is maybe you have you lack an anti-clotting factor in blood. There is an anti-clotting factor in blood we call heparin. Heparin makes now the blood not clot when it is flowing in the blood vessels. So if you are deficient in heparin, then it's also a possibility that a clot can happen, and that will be it. Now, there are many other factors. Let me not talk about them. Let me talk about the hemorrhagic stroke. Now, when hemorrhagic stroke, hemorrhage basically is loss of blood, and this happens when a blood vessel ruptures, when a blood vessel breaks or tears up. And maybe among the things that may cause a blood vessel to break or to rupture is number one, we refer to it as a brain aneurysms. Brain aneurysm means a weak bulging area in a blood vessel in the brain, like a balloon. A blood vessel may tend to bulge like a balloon in part of the blood, in somewhere in the part of the blood vessel. And if that part, I want you to imagine of a car tire. Sometimes you may go and scratch on something, and then the tire starts bulging on at some point. Then the likelihood of that point being pierced and getting a tire burst is very easy. So the same with a blood vessel. So we are saying that one can cause now that rupture of a blood vessel. Then we are talking about the high blood pressure. If at all it is very high or you have it for a long time, it can cause that blood vessel rupture. And then we have another disease we call the moyamoya disease. The main arteries that supply the brain narrow or they become blocked. So the narrowing or the becoming blocked, it is a condition that can now cause now the rupture, because there is blockage, the blood flow is not happening, then the blood vessel gives in and now ruptures and blood flows within the brain itself. So the hemorrhagic type of stroke, as you can see, the blood is flowing within the brain. The blood is flowing within the brain. Then we have the transient ischemic attack, and it's sometimes called a mini stroke, and it is a stroke, but the effects are temporal. They only happen for a short time, and these are often warning sign that a person has a very high risk of now a major stroke very soon. So that transient ischemic attack is a minor stroke. We can call it minor or mini stroke, and is a sign that the true stroke can happen anytime. So this person need to be taken care of. So those are the three types of strokes. Three types of stroke. And how do you diagnose stroke? How do you diagnose stroke? We have what we refer to as several tests that can be carried out. We have blood tests to CT scan. You know what CT scan stands for, computed tomography, and it's an X-ray that looks into multiple cross-section images of the body and then brings them together, as you can see this guy is doing, and then he is able to make a decision. Then we have the EEG, electroencephalogram, all these, and imaging, all these as medical tests that can be done to determine that indeed somebody has stroke. Now, let's talk about the treatment. Now, for the ischemic stroke, this is the minor stroke. We are saying you're going to use what we refer to as the robotics medication. The robotics is a type of drug that dissolves blood clots. So when it comes to ischemic stroke, we are saying thrombolytic medications or thrombolytics. They are called thrombolytics. These are drugs that dissolves the blood clots. So that is basically how you treat the ischemic stroke, or even surgery, or in a medication that can manage blood pressure. But when it comes to the hemorrhagic stroke, then we are saying what you need is a medication to stop bleeding, and then you also manage the blood pressure, which is a major cause, and also reduce the increased intracranial pressure. So the intracranial pressure is the pressure inside the skull. Skull is also called the cranium. So the intracranial pressure is pressure inside the skull, and it is exerted by the brain and even cerebrospinal fluid, the fluid that now fills the brain. So when that is reduced, then hemorrhagic, but basically stopping the bleeding. But then we also have what we refer to as stroke rehab. Stroke rehab basically is you need a rehab to adjust the changes in your brain and body after stroke. It's basically an ordinary rehab we talk about that we know, but this one basically is to help somebody adjust to the changes that has happened in the brain and even the body after a stroke. We have those that are cognitive in nature, that improves memory and concentration, but then there are those that are occupational in nature, to help in those individuals complete daily tasks and even chores and even activities that need body movement. But then we also have physical therapy. Those ones strengthen the muscles and even improve balance and even the gain of the use of the arms and legs. But then we also have speech therapy in the rehab now, whereby you improve language, speaking abilities, control, and so on and so forth. Now, need 2 or so of your minutes. Kindly bear with me, so that we started 8 minutes late, so 2 or 3 minutes. Now we have the stroke recovery time. Even after you receive treatment, it is common for the effects to linger for some time. And everybody responds differently to stroke. And we are saying restoring the prognosis after stroke depends on a few factors, including how quickly it was treated, which areas of your brain were affected, which type of stroke you had, the overall health. Most people take a few months for somebody to recover after a stroke. Now, the best defense is prevention. The best defense is prevention. I want to dwell here for a minute. Up to 90% of strokes are linked to modifiable risk factors, and you can prevent, like for example, controlling hypertension. Tame your pressure. Tame your pressure. Pressure being a major cause, make sure that you control, you tame that pressure at all time. Quit smoking. Smoking doubles your risk of damaging blood vessels. And then movement of the body. 30 minutes of moderate activity most days keeps the vessels very healthy. Remember, it's a disease or it's a condition that affects the blood vessels. And then diet, a low salt diet, what we called the Mediterranean diet. It fights the plagues, the hardening of the vessels. So eat smart, the Mediterranean diet. Know your numbers, the numbers that you need to know. You need to know your cholesterol numbers, the pressure numbers, blood pressure numbers. We've talked about that. Know your numbers.
Thank you. Thank you very much, Dominic, for that wonderful presentation on those two conditions that affect quite a lot of people, yet a lot of people have very limited information about them. You have spoken to us about what they are. Dominic? Hello? Dominic?
Yes, Fred.
You're done, or I?
Maybe 1 minute, 1 minute.
Okay.
Yes, 1 minute, so that I look at the product. Sorry for that. It's the network that. So these are the products that can really help when it comes to stroke. We talk about the Danshen Kobo, the Cardio Power. The Cardio Power have ingredient that improves blood circulation, and it's crucial after stroke to promote healing and prevent further complications like blood clots. Then we have the Deep Sea, which has anti-inflammatory effects. Deep Sea after stroke, inflammation in the brain can worsen and damage the damage to the brain cells. So the omega-3 have anti-inflammatory properties, and they reduce post-stroke inflammation and promote better healing. Then we have the same Deep Sea has neuroprotective effects. Omega-3 fatty acids are key components of brain cell membrane, and therefore they play a key role when it comes to fat metabolism and helps keep both the fats down in the liver. And then we have the super CoQ10, super CoQ10 is also important. And after stroke, the brain undergoes oxidative stress. And now super CoQ10, we know very well that it is an antioxidant. It's a powerful antioxidant, and it will help neutralize those free radicals. And then also, it is important for cellular energy production. It is essential for microbial function and energy production. Then we have now the lecithin capsule. This one is support the brain cell repair and regeneration. Lecithin, due to its high phosphate content, it is essential structure for function of the cell membrane, including function of the cell membrane, including those of the brain cells. It is key for brain cells structure. And then improved brain function. The lecithin also improved brain function and even the cognitive support of the same. Then when it comes to fat metabolism and cholesterol balance, lecithin also comes in handy. So with those four products, we can be able to control and take care of this condition. Thank you very much. Back to you, Fred. Sorry for that disruption. I think it is just a technical error. Thank you, karibuni sana. Sorry for the 7 minutes. I think I started late. God bless.
Thank you very much, Dominic.
Fred.
Thank you very much, Dominic, for the wonderful presentation and insightful tips. Basically, you've taken us through the whole thing, from understanding the conditions themselves to what the causes are, the symptoms, and the Greenwald products that we can use to manage these conditions, making life better. Thanks to all of you for attending this session and staying with us up to this hour. I just hope that it was not in vain, that you're sitting there and listening has allowed you to acquire one or two things that one or two pieces of information that you didn't initially know. And we also hope that the information we share or we've shared today and we share in our regular meetings are things that go a long way in helping you to improve your knowledge of health and also helps you to also grow your business. To all our friends and colleagues from across the world, thank you. I know some places it's late, but you've still managed to stay to find time to attend. So thank you very much for your support. So we've come to the end of tonight's training. Wishing you all a wonderful week ahead. It's only Tuesday. See you all at the top. Sante, I will unmute. I'll unmute all of you so that you can say your goodbyes and your good nights as we part. Till next time, you are all unmuted. Asante sana. Dominic, good night.
Yeah, thank you. Thank you, Fred.
Thank you very much, Dominic, and thank you, Fred.
Good night. Thank you, Madam Happy.
Good night.
Thank you all.
Thank you,
Mr.
Dominic
Charles,
and Fred.
Wana.
Good night.
Thank you, Nathaniel.
Thank you.
Good night.
Good night, everyone. Thank you, Dominic.
Nathaniel Ojang. Good night.
Good night.
Chris Obongo.
Good night.
Jennifer. Good night.
Kombo.
Good night.
Good night.
Good night. Zoma, good night. Apostle, good night.
Good night, everybody. Good night.
Mrs. Masharia, good night.
Good night.
Susan Kericho. Tawa.
Good night.
Good night.
Naivasha, good night. Mary
Good
Achishari,
night.
Good night.
See you next time.
Boy, good night.
Good night.
Dominic,